Hello student nurses, in this video we will be going over the eye anatomy, the sagittal cross-section view of it. So as always, let's get oriented to what we are looking at. So this is the side of the eyeball. Over here is the anterior, over here is posterior. So posterior would be towards the back of our head, anterior towards the front of our head. We will start with the outermost front part of our eye. It starts with the cornea. The cornea helps focus the light along with the lens. Next, we have the anterior chamber. This is filled with aqueous humor, that's the liquid. The aqueous humor helps keep the lens nourished. The lens is over here, and it also helps keep the pressure up in our eye. Next, we have the iris here, and then we have the pupil. Again, the pupil is a hole. It's a little tunnel that leads into the eye so that light can pass through and we can see. Next, we have the lens here. The lens helps focus the light. Back here is where the light will be focusing, and it differs with different eye shapes where the light will focus. Next, we have our suspensitory ligaments here. They're these three little notches. The suspensitory ligaments connects the lens to the ciliary body and muscle. So these three ligaments connect the lens to this muscle here. The ciliary body and muscle here and here help change the size of the pupil and also the shape of the lens when helping to focus the light. This whole thing here is the vitreous body. It's filled with the vitreous humor. This helps keep the shape of the eye. When you see humor, it usually means either like gel-like substance or like a liquid. Over back here, we have the macula luta, which is made up of mostly cones and few rods. Cones in our eyes are used to see bright light, and rods are used to see in low light, so like twilight time. In the middle here, we have the Phobia Centaurus. The Phobia Centaurus is made up of all cones and no rods. These cones and rods I'm talking about are photoreceptors, and they're spread throughout the retina. They help convert the light into signals that we can send down through our optic nerve so our brain can understand what we are seeing. Cones and rods get their name because cones are shaped like cones and rods are shaped like rods. Now let's peel back some layers of the eye. So this outer layer, it's called the sclera, or the white of the eye. So when you're looking at someone's eye, it's that white part that's surrounding the iris and the pupil. The sclera is there to help give shape to the eye. Peel back a layer, we have the choroid layer. The choroid layer helps give the retina nutrients. It's mostly made up of blood vessels, and it can also help regulate the temperature of our eye. Peel back another layer, and we're into the innermost layer of the eye, which is called the retina. The retina, as I said before, detects light and sends signals to our optic nerve so our brain can understand what we are saying. Here we have the optic disc, or in other words, the blind spot. This is where all of our nerves and some of our blood vessels go. We have a blind spot here because there's no cones or rods, and that's where all of the nerves go. So there can't be any light reception here. Some helpful tips that might help you in class. So if this lens here, if you have a question that asks what's it called when this lens gets cloudy, that's cataracts. That's my little note here. When someone has cataracts, it can make them go blind. Another helpful hint, if in class you dissected cow eyes, you may be tested on the tapetum lucidum, and that is the shiny part of the cow eye. I remember that because lucid, kind of shiny, lucid, like lucid dreams, it's bright and shiny. That is it for the sagittal cross-section of the eye anatomy. If you haven't already, go check out the anterior view anatomy of the eye. That's looking at the eye as if you're looking at somebody. I will have that video linked in this video. Thank you for watching. I'll see you next time.